Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Hi, welcome back to the Bridge to Health. My name is Dr. Tom Dow. I've observed over my many decades of life that the key to everything in the universe is communication. In order to have a good business model, you need to have good communication between your employees, your managers, your presidents, your vice presidents. In order to have a good marriage, you've got to have good communication. In order to have anything that works well, communication is essential. Could you imagine if you had a football team and there was no quarterback to communicate any of the plays that were coming up? He'd say, hut, 1, 2, 3, and every player would be thinking a different play, going in different directions, and not knowing what each other is doing. Do you think that your doctors, all the doctors you see, know what each doctor is doing? I doubt it. But in today's healthcare model, which we utilize in our office, all of our doctors work as a team, constantly communicating to one another about you, the patient, your health concerns. I may go to my orthopedist and say, look at my x-ray findings. My orthopedist may come to me and say, look at my MRI findings of you, the patient, your shoulder. And we'll sit down together and we'll develop a treatment plan with our neurologist, with our physical therapy staff, so we can give the patient the best possible care and communicate to each other most effectively for the benefit of the patient. Also, have you ever gone to a doctor and the doctor doesn't communicate to you? Doesn't really tell you what's going on? You really don't understand what a herniated disc is. You really don't understand what your CAT scan findings are, and he just basically says, do this, 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 and this, and I'll see you in 2 months. Our staff constantly prides itself on communicating very effectively and educating our patients on every aspect of your health, not just little parts, but treating you as the whole person. That's what our weekly show is about. It's about introducing you to all different healthcare practitioners that we work with, and show you exactly what each one of those practitioners does and exactly how we communicate with one another to give you the best, let's say, a la carte selection of treatments to get you to the maximal state of health. Today's topic is chiropractic, and I've been a chiropractor for 32 years. My guest today is my son, I'm proud to say, Dr. Madhousetv, Jr., who's been with us for about 5-6 years now. And we're going to be talking about a lot of things about what you think a chiropractor may be or may not be, and clarify a lot of the misconceptions that are out there and let you know what it is exactly a doctor of chiropractic can do. First, let's talk about how chiropractic was discovered. In 1895, a healthcare practitioner, which back then was called a magnetic healer, his name was D.D. Palmer. D.D. Palmer had a clinic, and the only people that went to his clinic in 1895 were those who no one else could help, and basically said, the medical profession threw their hands up and said, we can't help you. So they went to D.D.'s clinic. As a magnetic healer, magnetic healers used to just put their hands and run their hands and use their energy over the person's body to try to cause an effect to improve the person's health. Reiki practitioners today do something similar. And interestingly enough, a custodian who worked for D.D. Palmer, his name was Harvey Lillard, one day, through sign language, told D.D. Palmer that he had been deaf since the time he was a child, after getting hit by a horse and carriage out in the street. Harvey was about 6 years old at the time, I believe. And ever since that horse and carriage accident where he fell down and hurt himself, he was deaf. Harvey put him, D.D. Palmer put him on one of his exam tables and palpated the back of Harvey's neck and found a big bump sticking out at the side of his neck. D.D. said, "How long have you had that bump?" Harvey said, "Since I got hit by the horse and carriage." I don't know why, but D.D. Palmer laid Harvey on the table, took a book, and whacked this bump in Harvey's neck. Harvey got off the table and was able to hear. His hearing was restored by something that D.D. Palmer didn't even know what he did, to Harvey's neck. At that point, D.D., because he was very scientifically oriented, started studying anatomy, physiology, dissecting animals, and came up with the theory and philosophy of chiropractic that if a bone is misaligned in the spine, exerting pressure on a nerve that exits from the spine, it can have a multitude of different health effects on the person. And that is how accidentally chiropractic was discovered. I'd like to ask my son, first of all, let's clear up some information. Dr. Dow, what are the basic educational requirements? When you went to school, what do you have to do to become a doctor of chiropractic?
Okay, that's a good question, and I think a lot of people might think that the requirements for chiropractic are very minimal. However, most of the chiropractic colleges out there require a bachelor's degree first before you even can even apply to the college.
So that's a four-year degree.
Correct, yeah, 4-year college degree.
Just like medical school, you need a 4-year degree
It's about
before you can get
120 credits, college degree. Then you can fill out an application for the college. At that point, if you get accepted to the college, there's a couple of choices that need to be made, and either you could do it over a 3.5 period or a 5-year period, depending on how you want to space it out, and whether or not you want to take a summer break. But it must be completed in that time frame. So you're talking about a minimum of 7.5 years to about 9 years total.
So what you're saying is you need a 4-year degree, bachelor's degree first, generally, in order to get into school.
That's correct.
And then you need the equivalent of 5 years of postgraduate education, 10 semesters. Is that correct?
10 semesters, yeah.
And in that 5 years, do you do an internship? Do you see patients?
The internship is actually built into the last year of the curriculum. It's done in an outpatient facility, and you have to fulfill a certain amount of requirements: patient adjustments, diagnostic testing, X-rays, to get your degree with the college.
And do you actually see patients and adjust them?
Absolutely, yeah.
Okay, very good. And when you see a new patient and they walk through your door, what are your responsibilities and what do you do when you see a new patient? What is your responsibility? Do you need a referral to see you? Does a patient come to you as a primary care provider? What do you do? What are your responsibilities when a new patient comes into your office?
Well, a doctor's responsibility is the same as a chiropractor's responsibility for that patient.
You mean a medical doctor is the
Medical
same as a
doctor.
doctor of chiropractic?
Right. Chiropractors are considered portal of entry doctors in New York, which means somebody could walk off the street, come into your clinic, and be seen, and it's your responsibility to diagnose their condition.
So if somebody comes in and they have headaches, which might be caused by high blood pressure, you have to do a thorough exam. You have to make sure before you tell them you can help them that you've ruled out other things like high blood pressure, the possibility of a stroke, etc., before you even begin to work on them as a doctor of chiropractic.
Yeah, it's your responsibility to find anything and order any tests that are required to get to the bottom line and find out exactly what's going on with that patient. And if you can't help them, it's your responsibility to also send them out to the correct professional, whether they need an orthopedist, a neurologist. If they need to go to the hospital, we've had those cases too, and we've done the right thing.
How many times we've had a couple of times in our office where we've had life and death situations where we've had to call an ambulance and we've saved people's lives.
Oh, absolutely,
correct?
yeah.
Tell us about one of them.
Oh gosh, well, we did have one over the past year. We had a patient with very high blood pressure. I think it was 220 over 110.
Something like that, yeah.
And that person definitely needed emergency attention at that point. We then called the paramedics. They came in and brought the patient to the hospital. They got the care they needed.
Right. So, and basically, we have an advantage over just a primary freestanding chiropractic office, because we have other healthcare professionals in there with us as part of our team to help us. But again, our job as doctors is first to do no harm and then to help.
Right.
So tell me about, again, let's talk about a new patient walking in the office. What happens when they come to see you and they sit down with you? What's the first thing you do?
Well, usually the first thing I do is introduce myself in the waiting room.
Okay.
You know that, and
And you flex a little bit? Okay.
no, I flex a lot.
Okay.
But no, I bring them back. You know, I introduce myself. I bring them back to the exam room, and I sit down and have a comprehensive consultation with them. And they describe to me exactly where their symptoms basically came from, how long they've been going on, if they've ever had it in the past. And I do a full workup, including neurological testing, orthopedic testing, range of motion. Sometimes if we need to take x-rays, we do the x-rays there. And typically, the first visit, what would you say, about 45 minutes?
Yeah, 45 minutes to an hour usually. They're with us for the first visit.
And at that point, we usually like to take some time to review all the findings, the exam findings combined with the x-ray findings, to get that accurate diagnosis.
Right, so generally, do we adjust a patient or treat a patient on their first visit?
Very rarely.
And that's because we want to have time to digest the exam findings, we want to have time to review the x-rays, and then we want to sit down with them and we show them their x-rays, and we explain everything in detail as to what we found, and not only what the best chiropractic treatment plan is for them, but what other specialties in conjunction with what we're doing would help them along the way, such as?
Well, I mean, it's not only that, but we also have 3 doctors at our practice.
Right.
So we like to review those findings with all 3 doctors,
Right.
if possible. This way we have more minds on it.
Right. Right.
So the other specialties that we do have at the office are acupuncture, physical therapy, and orthopedic.
Mhm.
So we do find whatever the problem might
And
be.
massage, too.
And massage therapy, too. Whatever the problem might be, we can actually guide that patient and say, listen, Joe, Sam, you know, you should go for this therapy. I think it would be beneficial for you. I think it would accelerate the treatment and
Right.
the response time.
Now, as the doctor of chiropractic, you see them, you give them a report of findings, you go over their x-rays with them. What other tests are you allowed to order as a doctor of chiropractic?
Oh,
And why would you order other types of tests?
so chiropractors can basically order many different tests out there. CAT scans, MRIs, ultrasounds, bone scans, x-rays.
Laboratory tests,
Laboratory
blood
tests,
works?
right, blood work.
See, many people don't know that we order blood tests to diagnose certain things, as well as any other test that's necessary for the diagnosis of subluxation and to rule out other dangerous
Other
things
pathology, like
that we need
cancers and all
we
that.
need to refer them out to the appropriate specialties. Okay. And do you review your own MRIs when you order them?
Yes. I got my certification back in 2013 for MRI spine interpretation, which is an advanced course in interpreting spinal MRIs. It takes the college curriculum to the next level, in my opinion. You also have certification in the course. How'd that impact you, and how'd that make you above and beyond the regular chiropractor?
Well, what's great about it is I not only read my own films, but I also, when I see questions of interps, have the ability and the relationship with radiologists that we work with to be actually go to their offices and sit down with them. I mean, just last week, I went to a radiologist's office in his room where he reviews all the MRIs and sat down with him and said, look, doctor, I see something here that is affecting the patient. This patient has pain down their left arm. This patient has numbness in their left hand. And I'm seeing what looks like a left disc herniation at C5, C6. And he looked at it with me and he agreed. And he gave me an addendum to the report. You have to understand something, that radiologists, they don't have the information that we have on a daily basis. We don't know what arms, he doesn't know what arm is numb. He doesn't know what the reflex findings are. He doesn't know what the skin sensation losses are. We have all that information to, with bigger and wider eyes, be able to look at a study and zone in on something that might be relevant, that might be impacting that patient. And most of the time when we meet with radiologists, they're happy because that we give them that information so they can look with wider eyes like we do,
Yeah,
right?
I couldn't agree with you more on that one.
Right. So why would you need to order, let's say, if a patient comes in with abdominal pain, right lower quadrant abdominal pain, a little bit of a fever, why would you need to order a sonogram on that?
A patient might have an acute case of appendicitis.
Exactly, and that's what most people don't realize is that's what today's, and years ago when I was in school, doctors of chiropractic are trained to do. They're trained to find out what's wrong with you through whatever test it takes, make a diagnosis, and then refer you out to the appropriate specialist if it's not within our scope of practice. I had 3 appendicitis. We had 3 appendicitis.
I had it personally.
You had it personally, right? But we also had 3 patients that had appendicitis last year that we diagnosed
Yeah.
in the office and referred them out for surgery, and they had surgery and they're fine now. It's very important that your doctor, definitely that you go to, acts like the quarterback on the football team. Without a quarterback overseeing the patient's care amongst the specialists, it's like the football team trying to run a play without a play. And I'm sure many patients that are out there today are on a team where there's no quarterback. One doctor says one thing, another doctor says another thing. Their chiropractor says one thing, their physical therapist says another thing. And what does that end up doing? That ends up with confusion for you, the patient. You don't know who to believe sometimes, as opposed to a team that has a concerted effort to get you the best care and make the best diagnosis. What areas of the body, Dr. Dow, are you allowed to treat as a doctor of chiropractic?
It's a very good question. Typically people think that chiropractors can only treat the spine, and that's a misconception. Chiropractors can treat extremities. They can treat shoulders, elbows, wrists, knees, ankles, feet, as long as there's a spinal component. So let me give you an example.
That, by the way, that's only in the state of New York. Other states, we can treat those parts without a spinal component.
Right. Yeah. New York. So let me give you an example. If somebody comes into the clinic and they, whether they got into an accident or they're just having wrist pain, if we examine them and let's say there's a bone out of place in the neck, C6, C7, that's going to some of the muscles that go to the forearm that could be causing their wrist problem, we can treat both areas.
Right.
And it's legal.
Right. That reminds me of a story of how I got into chiropractic to begin with, why I ever became a chiropractor. Back in 1978, while I was teaching high school sciences, I had hurt my left knee, and I had surgery on my left knee. The knee was never the same, still wasn't stable. And a friend of mine in school told me to go see a doctor of chiropractic across the street to see if he could help your knee. I said, knee? Chiropractor? Those are spine guys, but I went anyway. I was examined by the chiropractor who found that I had a pinched nerve in my lower back, which was affecting the muscle strength and the support of my left knee. I underwent a treatment plan of care, by the way, I had no back pain, just knee instability. I went through a course of chiropractic treatment. My pelvis was down low on one side, all out of alignment, and I got my pelvis aligned through a treatment plan, and lo and behold, the muscle strength started returning back to my left leg, and my left knee became stable. So that's exactly kind of what you're talking about, right? Here's a patient who comes in, they have no back pain, but they have instability in an extremity, in a joint, which might be related to
The spine.
a spine and a
Spinal
nerve,
nerve root component, yeah.
right?
I don't think the audience quite know where these nerve roots go to,
Right.
and the parts of the body that they affect.
Right.
So let's get into that.
Right, so let's look
educate them a little
so
bit.
let's look at the first slide and take a look at what a normal spine should look like. Why don't you talk about that,
So a
Doc?
normal spine, basically, to any viewers that are looking right now, it consists of 24 bones. There's 7 of which that are in the neck, 12 in the mid-back, and there's 5 in the lower back. And if you see the diagram that's posted up on the screen here, you'll see that the spine has some normal curvatures, but when you look at it front to back, it should be totally straight. And I think this is a good representation right here. You see the neck is called our cervical spine, the mid-back our thoracic, and the low back the lumbar spine. At the bottom of the spine, you'll see that triangular bone. That's called the sacrum, and that's kind of the base or found. I like to think of it as the base or the foundation of the spine, because houses have foundations, and so do spines, and this is can be related to the structure. Okay, so so looking at the diagram on the left, you'll see that there's a curve in your neck that goes forward, one in your mid back that rounds back a little bit, and then one in the lower back that rounds forward again, just like the one in the neck. And if you look to the image on the right, that's what a normal spine should look like when looking at front to back. So can we just see the next slide there? Okay, so these are some areas in the spine. If you look, this is the cervical spine or the neck, and there's about 8 nerve roots that come out of the neck. These are some areas that they go to. So if you take a look, the C1 nerve root, which is the first nerve root in your spine, that comes out between the base of your skull and the first vertebrae of your neck. Okay, and that nerve root actually goes to some of the blood supply that's in your head. If there's a problem with the structure, and sometimes these bones go out of place, just like we were referring to before, it can affect and make a patient experience headaches as a result, as seen in the column to the right. Some of the other nerve roots, you see C2, that's a nerve root that might affect the eyes and cause vision problems. If you look down towards the bottom of the neck, you'll see C5, C6, C7, and these ones typically are the ones that go into the arms, that can affect the arms.
Let's see the next slide. And as you can see, the nerves that come out from different parts of the spine go to many different parts of the body and can cause many, many different symptoms that many people, if you look at the symptoms on the right, are taking medications for. They're just suffering without help. Where what you're saying is that if they have a subluxation or a bone out of place in their spine, pinching that nerve, controlling the impulses from their brain to those organs that are causing those symptoms, we can help them sometimes by correcting that pinched nerve and improving the nerve flow to that structure, and thus correcting the cause of that symptom, right? So we're not really treating the symptoms, are we?
No, we're treating the spine.
We're treating the bones out of place in the spine, and the symptoms resolve sometimes as a result of improving nerve flow to these structures. Can we see the next slide? Okay, so, and here's the bottom of the spine and some nerve roots where they go to.
These can cause problems with digestion. They can cause lower back pain or sciatica. Right.
Okay, on a future show, we're going to come back and we're going to talk about herniated discs and what they are. But for now, we're just going to end with a couple of more questions, which I'd like to know what you think. So from a corrective standpoint, when somebody has a herniated disc, does a pain management epidural injection correct the herniated disc?
Absolutely not.
What does it do?
Okay. What pain management is used for is exactly that, pain management. And if somebody has pain due to a herniated disc, it's a way to manage it.
Right.
It's a way to resolve it for a little bit. Just like taking an Advil, it kind of takes the edge off.
Do medications, painkillers, muscle relaxants, anti-inflammatories, do they correct a herniated disc?
No.
Have you ever corrected a herniated disc?
I've
reduced
a herniated disc.
Right.
Yeah.
I've reduced and corrected many herniated discs in my career, and the reason is that the herniated disc is the effect of the bones being out of place. If two bones are supposed to be like this, parallel to one another, and the disc is in between, and all of a sudden the bones are knocked out of place and the disc is in the middle, that disc has to move to that open wedge side. So by correcting the bones that are out of place and putting them back in place, very often the disc becomes reduced and moves back to where it should be. So the real problem, Dr. Dow, is the misalignment of the bones,
correct, yeah,
which push the disc out of place.
I think we have
right?
a slide for that too.
Yeah, we'll show it on the next show. Because we're going to wrap up in a couple of minutes, and I just want to ask you one question before we wrap up. So if somebody has a pelvis, a sacrum, which is supposed to be parallel to the ground for the whole spine to stand on straight, and all of a sudden that pelvis gets knocked out of alignment, and one side's lower, how would you correct that pelvis through adjustments? Would you adjust that pelvis back up?
Correct, yeah.
Right, so if somebody's pelvis is out of alignment, we got to adjust it back up and correct it. And often, if somebody has one leg that's shorter than the other, that's called an anatomical limb length deficiency. We would then put orthotics in their shoes. Okay. with a heel lift to make up the difference so that pelvis has a reason to stay up once we adjust
That's
it.
right, yeah.
We have to kind of look at the whole body from the bottom all the way up to the top and not just little pieces in between. And we have to look at the whole person as a human being, his nutrition status, whether he's overweight, whether he's getting enough rest, whether he's exercising, many, many different things within our team of practitioners to make the best possible decisions on how to change that person's lifestyle and help them cross that bridge to health. Dr. Dow, thank you very much. Thank you very much for being my son. And thank you very much for being part of my practice and making me so proud of you. And we'll have you back again soon. All right? Thank you. And if you're watching Madhouse TV, we'll be back in a few minutes. And if you're watching Cablevision, we'll see you next time. Have a good day.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Hi again. My name is Dr. Tom Dow, and you are watching The Bridge to Health. My co-host, Dr. Tom Dow Jr., is with me again today. And today we're going to be speaking about a great procedure that we've gotten great results with called stretching under sedation. A more common name for it is manipulation under anesthesia. The reason why we call it stretching is because most of it is stretching. And without telling you what it's about, what we're going to do is we're going to show you a video that we've created actually in the operating room with some other healthcare practitioners that we work with that really explains what the procedure is, who it's for, and what results can be expected. And at the end of the video, you'll see probably 5 or 6 of our patients who had the procedure done telling you about how this procedure has changed their lives. Again, remember, this procedure is not for everyone, only a select patient base. But when we select the correct candidates, which we always do, the results are remarkable. So without further ado, please enjoy our video, and after the video, we'll come back and give you a little bit more information.
Manipulation under anesthesia is a simple, effective, gentle way of treating patients who haven't responded well to conservative therapy in the past. The history of manipulation under anesthesia dates back 60 years and is accepted in the medical communities. It's a viable alternative to patients that haven't responded well to conservative or traditional care. Manipulation under anesthesia is one of the most effective, gentle ways of treating a patient with a chronic condition while gently sedated, effectively and safely.
MUA stands for manipulation under anesthesia. We more often like to call it stretching under sedation, because that's really what it is. 95% of the procedure that we perform is stretching. And you may ask, why does a patient need stretching? Very common after a traumatic injury, such as a car accident, whiplash injury, slip and fall, scar tissue forms within the muscles deep inside your body, within the muscles, within the ligaments. If you ever get a cut on the outside of your body heals that with a scar, and everybody's had a scar before. When you have a traumatic acute injury, that same scarring happens inside your muscles, inside your ligaments, and eventually prevents a body part that's injured from moving the way it should. That scar tissue also acts like little splinters inside the muscles, which cause pain, sometimes long-term chronic pain. So stretching under sedation, or manipulation under anesthesia, is a very gentle, very precise procedure to very slowly release any scar tissue that has formed as a result of a traumatic injury. Many people ask, how does this work? Will I get hurt? Will you stretch me too far? We only stretch the body part to its normal range of motion and never beyond that. So therefore, there's no chance of injury by going past that joint's range of motion.
Generally, patients who we might consider to have manipulation under anesthesia would be patients suffering from a number of different conditions. Anything from headaches, TMJ, neck pain, mid-back pain, sciatica, frozen shoulder. If a patient has been undergoing conservative care for a 6 to 8 week period and the results are not as expected, at that point in time, our staff would consider the patient for this procedure. Other types of patients who may also be considered for MUA include patients who have undergone a series of epidural injections who still suffer from pain, patients who may have undergone surgical procedures who may have developed scar tissue as a result of the surgical procedures, and those patients also may still be in pain. The MUA procedures is a safe, effective, and gentle way of helping those patients achieve the gains they intended to gain using the other procedures.
Manipulation under anesthesia is performed in an outpatient surgical center by highly trained specialists certified in the MUA procedure. The anesthesia portion of the MUA is performed by a board-certified anesthesiologist in the state of New York. The MUA procedure is performed by either a doctor of chiropractic, an osteopathic doctor, or a medical doctor who are highly specialized in the MUA procedure.
The results of manipulation under anesthesia are decreased pain, increased range of motion, increased activity of daily living, decreased medication use, and a healthier, happier lifestyle for patients. We find an efficacy of approximately 85 to 90% with most patients, which is very rewarding for us as practitioners. The screening process for manipulation under anesthesia allows us to safely and effectively choose the right patient base to do this procedure on. First and foremost, we go through a MUA screening process to make sure that the patient is a candidate for manipulation under anesthesia. After we carefully select the patient, we put them through a medical screening process, which is done to make sure that the patient can undergo anesthesia safely. We do blood work, EKGs, x-rays as necessary, review the MRIs, and make sure the patient is comfortable the day that they receive the procedure.
Other types of patients who may also be considered for MUA include patients who have just so much pain and they're so acute from their accident or injuries that in the office setting we can't often do a traditional conservative chiropractic treatment. Doing these manual therapies and conservative therapies while the patient is under twilight sedation is often a better and more effective way of achieving the goals we had hoped for in a conservative office setting.
After completing the post-MUA rehabilitation program, it's very common that our patients say to us, hey, I can play ball with my kid again. Hey, I can bowl again. Hey, I can enjoy hiking again. This is what makes it rewarding to us as practitioners.
During this procedure, we use only twilight sedation, which allows us to keep the patient readily available to get the procedure done within a probably 6 to 10 minute window. After that, the patient gently comes back to the recovery room and can go about their day as usual, with great benefits from the procedure given that day.
You'll find that when you schedule an appointment with our office, you'll be greeted with warm, kind, caring staff on the other side of the phone. You'll schedule your appointment, usually the same day. You'll sit down with the doctor in the privacy of the room, go over your conditions, your problems, see if we can help you. Once you're in the consultation with the doctor room, you will determine if you're a candidate for the procedure or not. So all of your questions have been answered. Our staff will walk you through the procedure.
We have a great success rate with just conservative care with our patients and taking care of them as traditional chiropractic practitioners. However, for the small percentage that don't respond typically to chiropractic care in the first 8 weeks of care, 10 weeks of care, this is a perfect fit for them.
We're extremely passionate about our patients' care, and using manipulation under anesthesia has really given us a new option for patients that gives us great results and that makes our job even that much more rewarding.
As a practitioner, I can't tell you how rewarding it is to see a patient who's been achieving no results after a course of 6 or 7 or 8 weeks of care. I can't tell you how rewarding it is to see a patient come out of the procedure after 2 or 3 days and have amazing results.
I was in a car accident. I've hurt my back and my shoulder very bad. I was going to my doctor for several weeks and my body wasn't working with the procedure he was giving me. So he thought that this procedure would be benefit for my health. I walked into this procedure and I was really nervous to have this procedure done since I was in a lot of pain. After having the first day under the anesthesia, I got a little more comfortable with doing this set 2 times over. It's a fantastic procedure. I feel a lot better than when I walked in the first day. It's only been 2 weeks and it's only getting better. After knowing what I know now about this procedure, I would recommend it to people that were in a lot of pain like I have been. At one point I couldn't lift my arm up too high and now I can lift it up this high. So this procedure is a good procedure for people in very chronic pain in their back and neck.
Back in April 2012, I was involved in a motor vehicle accident. I was rear-ended, and it left me mostly unable to walk. I could pretty much just shuffle around, and I had to take a considerable amount of pain medication just to get around, just to get through each day. And I became a patient and for a chiropractic, and I ended up getting a manipulation under anesthesia. And after that procedure, I was able to move around and I was able to function like a normal person again without having to take medication all day. I mean, truthfully, most of the pain is gone, not all of it, but I can, tie my shoes, I can go to the bathroom, I can even, kayak and do basic sports and things like that. My life completely changed after that manipulation. And prior to that, I didn't think that I'd ever be able to do any of those things again. And now I can pretty much live a normal life.
In 2010, I had a hysterectomy that went bad. My doctor, she performed a procedure too far to the left and injured a bunch of nerves in my hip. That caused hypersensitivity to my left hip and a bunch of scar tissue that developed in my abdomen region. Basically what that did was it's choked out the nerves that went to my leg, and for years I walked around with my leg dragging behind me. I couldn't do a heel stand or a tippy toe. I couldn't walk, do stairs. The pain that was in my leg was excruciating. I don't know how I survived it. I really don't. And eventually I was told about a manipulation and anesthesia. And I went and I had one done. It was a miracle. What they did for me was they performed the manipulation, and when I was in the recovery room I was terrified. I didn't want to move because I didn't want to see if I had success or failure. And when the doctors came in and they examined me, the first thing I could do and realized was that I don't have pain. I did not have any pain whatsoever. Then they performed different procedures to see what my level was as far as restrictions and rotation and movement. I was totally free of my restrictions. I got off the table, I could walk like a normal person, I could lift my leg. I could move in a way that I hadn't done in years. It was a gift. It really was a gift. I'm very much excited for anyone to try this. I think it's something that if you're in doubt, you should go for it, because I'm a prime example of why it should be done. And who should go for it? Anyone that the doctors feel needs it.
I was involved in 2 separate car accidents, first one being back in 2010, 9 months later being the second. I did have pre-existing conditions on my back and my neck, which were hurt in those accidents. I had back surgery due to those accidents, and then found out about the manipulation under anesthesia. After having the procedure done, being the MUA, I learned that the bulging discs that I had in my neck were no longer there. I only wish that I had known about this procedure prior to having my back surgery, because I honestly believe that I would not have had to have had that surgery if I had had that done first. I am one of the biggest advocates for this procedure. I tell everybody about it, and I highly recommend it to anyone who suffers from any kind of pain, any kind of disorder. After having my back surgery, I had found out that I was supposed to have neck surgery, which I was putting off, and then I found out about the procedure, and after the procedure, I then learned that I no longer needed to have the neck surgery, which of course made me very happy.
I came to get the MUAs after a bad spinal injury, multiple surgeries. I had scar tissue, weakness, found myself in a wheelchair for a couple years. Been through many a treatment, seen plenty of doctors, heard about the manipulation under anesthesia. Thought it was worth taking a crack at something else. And after the 3-day procedure, actually after the first day I felt some relief. After the 3 days, I felt mobility, range of motion was much better, and the pain was reduced significantly. And I'm out of the wheelchair, I'm sure not just because of that, but it was a big help, big turning point to getting me to where I'm at today. I was skeptical first coming into it because I've been through so many procedures where I didn't really get a lot of success. I was told by a lot of doctors not much they could do for me. So I always hope, and I hope that each treatment, everything that I try would work. So I guess I kind of took this with a grain of salt that this would hopefully do something for me, and was pleasantly surprised when I had significant help from it.
After an auto accident and years ago, I actually came to a center to see if I can get some help with stretching. My body was very stiff. I was unable to move the way that I used to, and I was concerned. My wife, children, everyone was concerned because, as you can see, I'm still a relatively very young man. My life had been changed. I met a doctor who suggested I try manipulations under anesthesia. Shortly after, it didn't take much to convince because the time in my life was very difficult right around then. So I went under and I did the procedure. Shortly after a short follow-up period of some physical therapy and muscle building, I felt like I was in high school again. All of a sudden, I was able to do things that I was unable to do before. I'm a pretty large man. I was able to bend down and put my palms flat on the floor. I started to feel a little more invincible, and I began working out. And then within 3 months, I dropped 74 pounds and started working out. And from there, my life has been changed. That was approximately 3 to 4 years ago. I haven't required or needed anything since then, and I feel I'm back in control of my life. I'm able to do things with my children that I was unable to do before, and at my age now, I'm actually 20 years younger than I was before the procedure.
I've suffered from fibromyalgia for about 25 years, and if you know anything about fibromyalgia, it can be very restrictive in terms of your movement. When you have a flare-up, it's very restrictive. You have a difficult time doing day-to-day activities. And as I was getting on in my years, it was getting worse and worse. And I was having a difficult time doing mostly anything. I've always been a very active person. Part of taking care of yourself when you have fibromyalgia is exercising every day. Otherwise, you really end up in a lot of pain. So I was getting to the point that my muscles were so tight, and the burning sensation that you get in your muscles from fibromyalgia was getting to be so debilitating that I couldn't exercise at all. And it was becoming difficult to even sit at a desk for a long period of time, or stand up for a long period of time. If I had a project to do and I had to stand for it, I wasn't able to do that. And it was getting worse and worse. And my chiropractor recommended manipulation under anesthesia, and had told me that it was very successful with a lot of other fibromyalgia patients. I had been seeing this chiropractor for most of my life, and he had always been very helpful to me, and I trusted him implicitly. So I was not frightened to do this. I was very confident in his suggestions, and it was not painful. It was really a piece of cake. You went in for 10 minutes for three consecutive days. By the third day, when I came out of the anesthesia, all of the burning sensation was gone. I was able to exercise within about 5 days. I was able to go into physical therapy, which is part of the aftercare, and had no problem lifting my leg all the way to my shoulder. It really did a lot for the problems that I had with the fibromyalgia. I would recommend it to anyone who has fibromyalgia. It gave me tremendous relief.
For years, as an adult, I've suffered from daily chronic migraine headaches, or just daily headaches that didn't go away. And it was my physician who mentioned to try it. And I said, I've never heard of it, what is it? And he said, basically, you go to sleep for 15-20 minutes. When you wake up, the procedure is done. You do it 3 days in a row, and hopefully there'll be results. Not fearing to lose anything, because I've tried every other medication there was known to mankind, and nothing was helping my headaches. I said, why not? So, for the next 3 days the following week, I did the MUAs, felt nothing, woke up 15-20 minutes later feeling basically refreshed. And by the 4th and 5th day, I noticed my headaches weren't as pronounced, as severe, and as the days became a couple of weeks, the headaches disappeared completely. I was shocked, and I was truly impressed. That said, I think that MUAs can be worked for anyone. I also had back pain, and which also disappeared, which I wasn't even thinking about at the time. But I've got to say that I would recommend it for anyone who has any kind of body aches, pains, muscle pains, back problems, and of course any kind of headache, or whether it's related to physiology or stress. I believed in it. It was painless, and it was wonderful. I have no problems since then, and I would recommend it for anyone.
I had come to get treatment for 2 car accidents that I had been in. That was almost a year ago now. I had the manipulation under anesthesia procedure about 4 months ago. It was life-changing. Before that, I had bad range of motion, difficulty moving, trouble sleeping, getting in and out of bed and in and out of the car was trouble. After the procedure, which went very quickly, the procedure helped me get the range of motion back that I wanted. It helped me, get treatment that I didn't think that I was going to even be able to. They had spoke about back surgery prior to that. And after having the manipulation under anesthesia, I don't need back surgery. So it's actually been a great success, and I look forward to the rest of my life.
Thank you very much for watching our video on manipulation under anesthesia. If you have any more questions or concerns or would like to come in, please don't hesitate to call any of our offices, schedule an appointment, come in, speak to a doctor. I hope you can benefit from the procedure like many of our other patients have in the past.
Welcome back. I hope you enjoyed our video on stretching under sedation or manipulation under anesthesia. We absolutely enjoy the results that you have just seen, that only a small number of our patients that you saw in that video received. There are many other patients which we could have put on the video, but unfortunately not enough time. Again, the key, as I think you would agree with Dr. Dow, is the selection of the correct candidates.
Absolutely, yeah. The key is the selection. And I think if the patient is selected the right way and appropriate regarding on which doctor that you decide to get this procedure, if you do,
right.
The selection is key to success.
And we get these are not just our patients we work on. We get referrals from many different specialties: surgeons, other chiropractors, people who have failed surgery, people who have failed pain management, people who basically there's nothing really left to do. Mm-hmm. And we've had great results with that class of patients, right?
Absolutely, yeah. This is a procedure that's done as a last stage. I couldn't agree with you more on that. And basically, if you're scheduled, you might be scheduled to have surgery. This is something that should definitely be considered before doing that, because, again, surgery is permanent.
Right. And I'm sure. Explain to the audience that there are certain patients we cannot do this procedure on, such as people with medical conditions where they can't have anesthesia,
right,
where it's too high risk,
high blood pressure.
So we have to make sure that they're seen by their primary care doctor first, cleared for anesthesia as any surgical candidate would be. Then there's cleared by the anesthesiologist in the facility where we work. So there's multiple clearance levels before we even consider working on a patient.
That's correct, yeah.
Okay. So I'd like to end our show today with a couple of comments. Communication is where we started this program. Communication is key toward the success of any team of doctors that are caring for a patient. Communication between the anesthesiologist, communication between the doctor who's working on the patient, communication between the radiologist talking to the doctor about the results and the doctor not just reading his report, but taking an active role in reading the films himself. Communication to the patient, letting you, the patient, know exactly what's wrong with you, educating you as to what your condition is, educating you into things you can do on your own, in your home, to help yourself get better. We can only help you for a brief period of time while you're in your office. Our patients take an active role in helping themselves at home with their families in order to have maximal results for their conditions. Wouldn't you agree with that, Dr. Dow?
Absolutely. You have to be proactive with any type of health care. You have to change the activities of daily living to suit what is suitable for you at that time. If that means laying off from going to the gym, if it means not carrying things for a short period of time to get your health well and better, if that's what it takes, if that's what the doctor suggests, that's absolutely what the role that you have to take at home in order to go with your doctor's suggestions and actually get well. So I couldn't agree with you more on that one.
Right. So anyway, I'd like to close the show and thank you all for watching. If any of you out there are interested in speaking with us at any of our offices, we'd be happy to do a consultation with you to see if we're the right doctor team for you. Thanks again for watching. Have a great day, and we'll see you next time.